Hey, everybody. Thanks for joining us. This is Luis Figueroa. I'm the Legislative and Policy Director for Every Texan, formerly the Center for Public Policy Priorities, CPPP. Today, we have a great set of panelists today. We're very excited. We just finished, the Texas primaries. So we are stepping back from the politics and getting back into the policy. We have a great discussion today about some things that congressional leaders and also some of our state leaders can do to really help people who are suffering right now in the middle of this COVID-19 crisis and the economic recession that we seem to be in, and with very few signs of recovery happening. We really believe that now is the time to put some pressure on our leaders because there are Texans, there are families, there are people of color, there are immigrants that are really suffering right now. So we have a great panel before you. So again, I'm Luis, the policy director. We also have coming from us from a national scene from the Center on Budget Policy Priorities. We have Deborah Swerdlow. We also have Stacey Pogue, who is our senior policy analyst at Every Texan, does a lot of our healthcare work. And we have Jonathan Lewis, who has been really leading the effort for Every Texan on unemployment insurance and worker rights. So we're going to go ahead and just jump into it. Feel free to chat us on Facebook Live. We'll try to answer as many questions as we can. We'll try to get through this under an hour, but thank you again for joining us. So before we jump into some policy recommendations, Deborah, I was hoping you could give us a little bit of context. What's the congressional landscape looking right now as it pertains to COVID-19 and the economic stimulus funding?
Yeah, and thank you so much for having me. Really glad to be here with everyone. Luis, as you queued up, and I think everyone probably tuning in knows, there's incredible hardship in Texas and around this country right now caused by the COVID-19 pandemic and the recession. People lost their jobs, lost income, struggling to put food on the table and pay rent. And the aid that Congress has passed so far in the previous few months has helped people, get through some of this hardship and be able to, find new ways to try to make ends meet. But many people were left out. And much of the aid that was passed, and I know that some of that will be talked about later, is soon going to expire. And so, the backdrop for all of this is what we really need is we need Congress to do much more and soon to help all of us get through this crisis. We need things like an increase in SNAP benefits so that people can put food on the table, buy groceries. It also stimulates the local economy. We need extensions in unemployment insurance. We need more aid to states, cities, and towns so that they don't have to make devastating cuts to their budget due to the budget shortfalls that they're facing because of this pandemic and recession. We need housing assistance so that people don't become homeless amid a pandemic, quite possibly the worst time to become homeless. We need to make sure that health coverage can continue, all of these things. So where things stand now is that the Senate is actually on recess. They've been back home, reading the same paper that you're reading, and going to pick up their mail and all of those things. And they'll be coming next week, and coming back to DC next week. And we expect that next week, when they get back to DC, Senate Majority Leader Mitch McConnell has said that he is going to unveil his plan for COVID-19 relief. You may remember that at the end of May, almost 2 months ago, the House passed their plan called the HEROES Act, and we haven't seen a plan from the Senate, and we have not seen the Senate take up the HEROES Act. Next week is when we expect to see a Senate Republican plan from Mitch McConnell. And we're already starting to get some hints through press reports, comments that he's made of what could be in that package. And I got to say that some of it is not looking good. He's talking about capping the package just arbitrarily at $1 trillion instead of actually doing the things that are needed to meet the magnitude of this crisis, the scale of this crisis, and give us the aid that's going to last throughout the recession. There's the risk that this package is going to leave out critical things that people need. Some of the things I mentioned above, like SNAP benefits increase, we haven't heard him talk about that. It's uncertain what he's going to include in terms of aid to states and local governments. And there could be some things in that package that ultimately don't put people first and meet the incredible needs that people have. So when we see that package next week, we're going to need to respond quickly and strongly to whatever comes out, because after that is when they're going to go into negotiations between the House, Senate, and the White House. And everyone is trying to reach a deal by the first week in August. Obviously, aid is needed, frankly, even sooner than that, but the sooner that Congress can put together a package that does right by everybody and helps us get through this, the better. And they say they're gonna try to work on this pretty quickly and have it done by the first week in August.
That was a lot of information there. Let me pick up on a few things there that I think are worth repeating and pointing out. So one thing you mentioned was the Senate is on recess right now, or Congress is on recess right now. I've often heard, and I kind of remember from when I was doing more federal advocacy than state, that that's a good time for constituents to hit their representatives and their senators because they're at home in their home districts. Is that the case? Is this a really good time to be sending letters or emails to their representatives while they're on recess?
It absolutely is. And I wouldn't stop it just because they go back to DC. One thing, the pandemic has upended a lot of things in our lives, and including it has upended how Congress works. And they've really, they had to work remotely for much of in March, April, and even into May. So even, when they're on recess, definitely they are, they're doing all the same things that we're doing in terms of interacting with their communities as safely as they can. So you may also have chances to, go to, like a teletown hall or something. Obviously, they're making accommodations to be safe, because of the pandemic. But all of those ways, you can also engage with people next week and the week after. Emails, phone calls. They are paying attention and they need to be paying attention, and you can get in touch with them in on all of those ways next week as well.
And the other thing you mentioned is the House has already passed the HEROES Act. So now we're looking to the Senate to come up with their own plan. We have obviously two senators here, Senator Cornyn and Senator Cruz. Cruz has traditionally been considered to be more conservative. Cornyn, as you probably know, is up for re-election. Are those two senators that will be part of the discussions in terms of what goes through? Are they critical to this issue as well? And just wanted to get some context there in terms of our own senators.
Mhm. Yeah, well, no matter what, you always want to be contacting your senators and your representative. That, you are their constituent and they are there to serve you and listen to you. So, it's always good, and you always have a right to and should contact your senators and your specific representative depending on where you live. As you look at your delegation, I think it's also important to think about any members who are in positions of leadership, because these negotiations are between the House, the Senate, and the White House. And so ultimately, there's going to be a small group of people who are actually sitting at a negotiating table or having their staff sit at a negotiating table and try to hash things out. And so if you have somebody who is a member of either the Senate Republican or Senate Democratic or House Democratic or House Republican leadership, and that could be, the official leadership team for the caucus, or they might be, a leader of one of the affinity caucuses, like the Congressional Hispanic Caucus or the Black Caucus or something like that. Those are people who are going to be a little bit closer to the negotiations. And so definitely important to weigh in with those folks.
To weigh in with their congressional members as well, because when it gets to a negotiated bill, they'll also have a say as well.
Yeah, ultimately, everyone's going to be voting on this bill.
Mhm. That's great. Let's
Whatever
bring it
gets
home a little.
negotiated.
Sorry, go ahead.
Oh, I was saying whatever gets negotiated, whatever this
Yeah,
final deal is.
of course. Let's bring it home a little bit. And I understand, Deborah, you may have to leave a little bit early, so we really appreciate your time. But if you can stick around as long as you can, and if there's questions that come up, we'll try to filter them to you. So thank you so much again for that great context. I wanted to bring it home a little bit and bring Stacey into the conversation. Obviously, this is a big issue here in Texas. We are one of the states that has been having a difficulty recovering from COVID. The numbers are still rising. We're hearing about decreased hospitalization rates. in big areas of the state, including Houston, the Rio Grande Valley. I just got reports about my home city of El Paso. Stacey, I hope you're still with us. We were hoping you could talk a little bit about how staggering the COVID-related job losses are affecting Texas and access to healthcare coverage. We may have lost her here. Let's see. Yeah, okay. So I think we had some technical diff there. We lost Stacey. Before we jump into that, why don't we, Deborah, talk a little bit about what you are hearing across the nation in terms of some of the COVID impact, and then when Stacey goes on, we'll hit up Texas a little bit.
Mm-hmm. Sure. So, you know, I think we at the Center on Budget, we have a lot of policy analysts. Oh, I think Stacey might be joining us, so I can wrap up my point quickly if I need to. But we have a lot of policy analysts who are always looking at all of the data. We love data, just like our friends at Every Texan. And they're, the data is really showing the hardship that people are experiencing. And we'll have some new data out next week that I think is really going to dig into this by state in terms of, how many parents are reporting that they didn't have enough food to last them through the month, or have enough food for their children, or didn't have enough money to make rent. I think one of the things that really makes aid from Congress urgent in the next few weeks is that a lot of places across the country put in moratoriums on evictions, so that if people were not able to pay their rent because they had lost their job, at least they would not be at risk of eviction right away. But those eviction moratoriums, many of them are expiring this month at the same time that a lot of, this aid from Congress is expiring as well. And so, I hate to say it, but if you think we're seeing hardship now, it's only going to get worse if some of these provisions expire and Congress doesn't step up and provide the aid that is needed to get us through this. There are some things that really only our federal lawmakers can do, and we're counting on them now to do it.
I appreciate that. I do have some stats here. Maybe Jonathan can weigh in until we get Stacey back here. But we do know that per COVID, about roughly half of Texans got their health insurance through a job. And we, of course, have experienced huge job losses. We understand the last few months, 670,000 Texans adults became newly uninsured. We've had one of the worst uninsured rates and largest uninsured rates in the nation. And now it's far worse. Jonathan, do you want to talk a little bit about the job losses and how people are struggling with that right now?
Yeah, definitely. I mean, we in Texas, as every state or in the nation, are experiencing the highest record of unemployment that we've seen, at 13%. It's millions of jobs that have been lost, and so when we're talking about what's happening, even with the unemployment system, there were approximately 2.7 million Texans that applied for unemployment insurance since March. And that represents about 20% of the workforce. So what we're seeing here is just drastic numbers that we've never, ever seen before in the past. So
That's staggering. Stacey, do we have you back? How are you doing?
Fine. How are you guys? It's good to see you again.
Good to see you. Thanks for jumping back on it. We talked a little bit about some of the job losses in Texas, and we talked about the uninsured numbers. But do you want to talk a little bit about why it's such a staggering hit to Texans, particularly when it comes to health insurance and the lack of safety nets coverage for situations like this?
Yeah. Well, so in Texas, before COVID, half of us roughly relied on job-based insurance to get our health insurance. And so when we've been losing jobs left and right, that means we're going to lose health insurance. And we know now that just in the last few weeks, nearly 700,000 Texans lost their job-based insurance and didn't find other coverage. They became uninsured. We already had the highest uninsured population, the highest uninsured rate, but now it's higher. And estimates are that 3 in 10 adults between the ages of 18 and 64 are now uninsured. If Texas had all along tried to implement the Affordable Care Act and get maximum benefit out of the Affordable Care Act, we'd be in a way better position. If we had a marketplace that we could have opened up to let people in, if we had Medicaid expansion, but as viewers know watching this, Texas undermined or just ignored the Affordable Care Act at every turn. So now we're in a position where we have people in Texas have far fewer options when they lose their job-based insurance to get health coverage. And in fact, what we know from researchers from the Urban Institute is that Texans actually face the longest odds in the entire nation of getting any sort of coverage after they lose job-based coverage.
Mm. Wow. And I know we're going to get a little bit into the weeds here, but we're going to try to break it down. So we know Medicaid funding is part of the solution. We have this formula that's in place. Can you give a little background of how that works and why federal Medicaid funding is part of the solution?
Yeah. So Deborah talked at the top about items we need Congress to do and to do quickly. And one of those is to increase federal funding for Medicaid to states. One reason for that is because we expect and want Medicaid to be a program right now that can grow to make sure we're covering people who are losing jobs and losing income, that they're still connected to vital healthcare services, and that our healthcare system is supported and getting payments through Medicaid. And one thing, one great way Congress can do that is by increasing its federal share to the state from Medicaid. It's a state-federal partnership. So roughly, in normal times, Texas pays about 40% of Medicaid costs, and the federal government pays about 60%. But as has happened in other disasters like the Great Recession, Congress can step in and increase its share. That takes the pressure off the state budget, right? But it also gives us the resources we need to make sure people can get the services, the healthcare services they need in Medicaid at a time of crisis like this. So Medicaid is health coverage for low-income Texans. It's low-income kids, pregnant women, seniors, individuals with disabilities. And this would be a terrible time to cut the program they rely on for healthcare services. In a lot of cases, seniors and individuals with disabilities get services funded by Medicaid in their homes, and that keeps them out of nursing homes. And the last thing we want is people forced into nursing homes that are struggling so mightily to keep people healthy with COVID, given COVID. We don't want to be forcing people into nursing homes, and we don't want to cut Medicaid and make the eligibility workers, and we get a backlog of people waiting to get into Medicaid, which reduces their access to COVID testing or COVID treatment. Mm-hmm. So what we need to do is Congress needs to step up, give more money to states for Medicaid, just like they did in the Great Recession. They've done it a little bit, but it's nowhere near enough. And so this next package needs to contain much more funding for Medicaid.
That's a great transition. Deborah, is this part of the discussion in Congress? Is changing that formula going to be part of some of the discussion between the House and the Senate and negotiations?
I mean, we absolutely hope so. As Stacey said, it's a very critical form of relief, not just for the state budget, but also in terms of making sure that Medicaid at this crucial time can be there for so many people who use that program for health coverage. The HEROES Act did have another increase in the federal share of Medicaid funds that is provided to states. And that is also similar to what the Bipartisan National Governors Association has called for. So governors across the state, as well as local government associations, hospitals, healthcare providers. So there's a lot of support for this, but certainly no guarantee that it makes it into the final package. So, again, we'll want to watch to see if the Senate Republican plan next week includes another increase in federal Medicaid funds. The wonky term is FMAP. And if it's not there, that's going to be a really important issue to lift up for your senators and representatives as one of several policies that are important to be included in the final negotiated package.
I appreciate that. We're seeing a lot of comments about Medicaid expansion, Stacey. I think there are other policy changes that we're looking on the statewide too, beyond the congressional discussion. Do you just want to touch on a couple of those of other policy changes for both state and federal that would help coverage and help the Texans, particularly those that are low income and people of color?
Yes, thank you, Luis. I appreciate that. So as commenters have brought up, yes, what we need to do first and foremost is the Texas governor needs to and should expand Medicaid right away. We knew before COVID that 1.5 million adults in Texas were uninsured but could get covered if we'd expand Medicaid. And that number is higher now, and it'll be higher yet again when some expansions of uninsurance benefits expire that Jonathan will get to later. So, we will have millions of people in Texas who are needlessly uninsured. that hurts them, and it burdens the healthcare system. So we need to expand Medicaid just like most other states have. It doesn't, and it won't just help. It'll help not just people who are losing jobs and income and are newly low income and struggling to get coverage. It helps people who have low wage jobs and have to report to work every day as frontline essential workers in retail store clerks, grocery store clerks, daycare centers, home health aides. So it does a lot to support people and help them stay healthy and keep their jobs in essential low wage work. And of course, we need Congress to act to some other things that we're calling on Congress to do is put coverage as one of the central pieces of its COVID response. Early on, Congress took a lot of steps towards testing and treatment specifically for COVID, but nothing for coverage more broadly, even though we're shutting jobs and job-based coverage. And so Congress needs to increase the subsidies that are available in the marketplace so people can afford coverage, reopen the marketplace. It's usually only open for a few weeks at the end of the year, except for special circumstances. So we need to have a broad opening where people can come in and get covered, which is, by the way, exactly what happened after Hurricane Harvey, right, and other disasters. Mm-hmm. And finally, we need to make sure we're funding the outreach and enrollment systems needed to work with people who've lost jobs and lost income and give them one-on-one help and help get them enrolled in our coverage programs.
I appreciate that. Jonathan, thanks for hanging out with us for a little bit. I really wanted to turn back to you on the unemployment issues. So what are some changes to unemployment that you're hoping Congress will take up?
Yeah, so just for some context, the Congress passed some amazing expansions of the unemployment insurance system to accommodate for this unprecedented, need. And so some really important things that they put in place was firstly expanding eligibility for unemployment insurance to those that are traditionally not eligible for state unemployment. So these would be people that are 1099 employees, so like independent contractors, people that work for app-based services, or there's a lot of instances of janitorial staff or home health care workers being independent contractors. And so what this did was expand that to basically anyone who works is now eligible for unemployment insurance. The other big thing that they did was add an extra $600 a week to everyone who's receiving unemployment insurance. So even if you're getting $1 of unemployment insurance through the state, you're automatically going to get this $600. And this piece was incredibly important for maintaining kind of some economic motion and keeping people with the ability to afford rent. We mentioned before the crisis of evictions that we could see as moratoriums on evictions end at the same time as this, extra $600 a week is being taken away. And so what we need in the very immediate term is for Congress to extend the $600 a week benefit. That's set to expire at the end of this month. So folks in Texas will get that last payment of $600 on July 25th. So Congress needs to act quickly and understand the importance of this. There's been some studies on this and the impact of this extra $600 a week, and there's estimates that if Congress didn't do anything, that Texas could lose upwards of almost close to 500,000 jobs permanently by 2021.
Jesus.
And then there's studies that support, like, if it's extended, there's these jobs, just the $600 a week piece could lead to saving around 300,000 jobs. So this is a critical part of our recovery if we want, especially seeing as caseloads are unfortunately rising again and businesses are having to shut down again. We're going to see again people who may have been on unemployment insurance who have transitioned off as their company opened back up, who are now potentially going to have to swing back on and get on to these benefits. And without that extra $600 a week, they're going to be pretty hard pressed to afford basic needs.
So that was a lot of information there. I think I wanted to highlight that if you didn't catch all of that, we did put it down on paper. Do you want to talk a little bit about the piece that Every Texan and AFL did together, the 10-point plan, and how that came together and what some of those recommendations were?
Yeah, definitely. I think we can link to that in the chat somewhere. But so I'll just kind of briefly go through these. This pandemic has really exposed a lot of weaknesses in our unemployment system. it really wasn't ever designed to handle the capacity that it has been asked to handle at this moment. And so we're recognizing that we really need to do a lot of modernization of our technology. We need to increase staffing, and we need to have plans in place so that when, potentially when high need times come up again, that we're ready to address those. We talk a lot about removing some bureaucratic barriers. So, what we saw a lot during this crisis was, folks not being approved for unemployment insurance, but then not knowing that they have to follow through and actually request a payment. So you get a notification that says you're approved, but you don't get a payment unless you actually go in to a system that was already bogged down and then request a payment. So we think there's a lot of work we can do, especially in times of high need like this, where we can make this process smoother, reduce the burdens of, applications and the burdens of, requesting payments so that the funding can get out as quickly and efficiently as possible during these high need times.
I remember along those lines when the unemployment numbers were really rising up and people were trying to get a hold of the agency and the workforce, that staffers were telling constituents to call at 2 a.m. in the morning or 3 a.m. in the morning, and that was the only way to get through. So is that kind of what you're talking about when in terms of the system being overburdened?
Definitely, and there's lots of ways, not only just improving the capacity of the system itself, but there are a lot of ways that we can change the system to be more user friendly. There's a lot of, the system was kind of designed to be a little bit difficult, and I think that was intentional to reduce the number of people that are actually the intention was not to make it too easy to receive this aid, and we think that that's really shown how problematic that design has been, and we really need to focus on the importance of getting cash to people when they need it. There were folks that were out of work for months before they even were able to get through to the Texas Workforce Commission, and so think about all the expenses they incurred in that time. And there's a lot of people that are probably experiencing a lot of debt at this moment, stuff that they're going to have to pay back that, that debt's not going away. So it's critical to get the cash out as quickly as possible especially in times like this.
Mm-hmm. Deborah, is there anything you want to add on the congressional side of some of these unemployment changes? How the conversation is going there, or where you think people can be most effective in terms of advocating on the congressional side?
Yeah, I'll just make a couple of quick points, and thank you so much, Jonathan, for everything that you've shared. I would just underscore that, yes, the additional $600 a week that people are eligible for, absolutely critical. We definitely want to see that extended. McConnell has been making some comments about extending it, but not having it be the full $600 per week. Not quite sure what amount they would settle on. So we'll have to look for that. But another thing that you mentioned that is also really important to get extended is not just how much you get from unemployment insurance, but who is eligible to get it. And that needs to be extended as well. That doesn't expire at the end of July. It expires later in the year, but it's really important. And if there's any other changes we can make to expand who's eligible for those benefits, that would be important. And the last thing I'll say is that duration for everything, unemployment insurance, SNAP benefits, federal Medicaid funds, all of that is important. So we need to be looking to see what Congress is going to do, and also how long they're going to keep it in place. And what we would like to see and what people really need is for those benefits to be in place for as long as the need is there, as long as unemployment is at these incredibly high levels. Unemployment insurance, SNAP benefits, housing assistance, all of that needs to be there for them.
Definitely, that's such a good point, and I think there's a big push right now that the next package expands these benefits and puts it in an automatic trigger. So we don't want Congress to have to act on it every time we see this, high need times. We need it to be an automatic trigger so that it just clicks on as soon as the need is there. It's a great point. Thanks you for bringing that up.
I think one issue we haven't talked about that we don't, necessarily have time to go into too much detail on, but that immigrants, particularly some immigrants who are of mixed status, they're one spouse maybe of one status and another status or another spouse. that in the last congressional stimulus plan, they were left out. Particularly, they had filed through an ITN, an individual tax ID number. So I wanted people to know that we have written about this. We're going to put our blog out on the Facebook page, and so people can check out that immigrants also need to be part of the stimulus coverage. But I did want Deborah to just, if you have to say a couple of words, if that's also part of the discussion, and other ways, and maybe any other issues that you think we haven't had a chance to cover that you think we should mention.
Mm-hmm. Yeah, well, this is definitely an important issue. And, as I said at the top, some of the the aid that Congress has provided has been incredibly helpful. But the two problems is that some of it is going to expire soon, and some people were left out and either got little or nothing. And definitely immigrant households and immigrant families were left out. They were left out of the stimulus checks that were, $1,200 per person and $500, for dependents. They were left out of some of the other aid measures as well. One thing that Congress can do in the next package is retroactively make those stimulus checks available to all households, regardless of the status of the people in their households. There is some talk about doing another round of stimulus payments. Certainly, if that's going to happen, that should be made available to immigrant families as well. Although, we definitely want to be looking for the issue priorities that were mentioned here too before, we start talking about additional stimulus checks that aren't as direct and targeted. And then there's another proposal that could help, states help immigrant households. And it's something similar that was done in the Great Recession in 2008, which was an emergency fund that states could then pull down from in order to provide cash assistance and, other forms of assistance, even subsidized jobs, once it's safe to be doing those kinds of programs. So that's something that states could work on, and they could design a program that works for what they're seeing in their state and, make that available to all households in need.
I appreciate that. So I think we're going to do a couple of questions. Let me just say before we get into that, Jonathan, are there some other organizations that work on workers' rights that you would suggest people also look up? Obviously we don't have the answer to everything, and we work with a lot of great partners and allies. Are there organizations that you've been working with closely that are working on these issues that people should also look up and reach out to?
Yeah, definitely. A major or big source of some great information on this is NELP, which is the National Employment Law Project. So you feel free to go to their website. They have a plethora of information about unemployment insurance and some really great advocates on their team.
That's great. And I'll just mention locally, Workers Defense Project and Texas Organizing Project are really great advocates as well. And of course, we partnered with the AFL-CIO on a lot of issues and on this. So I think there's some questions coming up that are coming up. I'll see if we can get to some of those. Stacey, I see you're back. Wanted to check in with you in terms of what do you see as the most important steps in the next short term, things that you're looking for as we start seeing the primaries are over and people are starting not only to look at Congress but also starting to look at the next session coming up after November?
Well, our top priority, before session, it could certainly be done before session, is expanding Medicaid. But if not, we'll be looking at doing that during session. We'll have another big job of making sure we protect funding for Medicaid. There'll be pressure on the state budget, but we have lots of choices that we can make in Texas about how we're going to fund essential services like healthcare services, and how we're going to make sure that people who've lost their jobs and lost their income and are struggling aren't having to choose between putting food on the table and paying rent or getting healthcare. So we'll be looking a lot at making sure we're protecting Medicaid, making sure we've expanded Medicaid. And I think those will be the top two, central ones on healthcare. But there'll probably be some targeted things for COVID as well. We're still working to make sure that kind of the big picture promise in earlier congressional COVID packages that people could get COVID testing at no cost, regardless of whether they have insurance or not, and regardless of their immigration status. It hasn't worked on the ground nearly as smoothly as kind of the big picture promise. So we're still trying to troubleshoot those areas and help make it a reality that we can say in Texas that people can get testing if they need it without worrying about being left with big bills.
All right. I see one question, and then I'm not sure if Stacey the right one. It says, when does extended Medicaid benefits require a new application for benefits?
Yeah, so here's my guess on what that question is. And by the way, follow up with me if I misunderstood your question. But one of the good things that's happened at federal and state level is that Medicaid denials, or when you're covered would terminate normally at the end of your period, those terminations have been paused for right now because of COVID. So when women give birth, normally they lose coverage 2 months postpartum. But for right now, we're not taking away Medicaid. When a new mom has a new baby, 2 months after she gives birth, and the same with kids, for example. And so those extensions, I believe, are pegged to the duration of the federal public health emergency. But there will be a time, presumably we'll come out of this and those extensions will go away, and we'll be working really hard to make sure that happens in a manner that doesn't hurt, that doesn't happen overnight and doesn't hurt the people who are benefiting from and relying on Medicaid.
Thank you, Stacey. I'm not seeing too many questions, so I'm just gonna go ahead and give people a chance to give some conclusion wrap up statements, and then we'll probably call it. But feel free to continue putting in questions, and if we don't get to your question today, we'll post it in the comment section. So let's just go around. Deborah, do you want to give some conclusion statements on what you want people to remember the most from this, and if they only skip to the very end, what do you want people to know?
Great. All right. The pressure's on. I want people to know that Congress is coming back next week, Monday, July 20th, and that is when the negotiations are really going to start. So be weighing in before then to help shape what your senators and representatives are going to prioritize and talk with, their fellow members of Congress about. Be weighing in as these negotiations are happening, as we're seeing proposals be released, as we're hearing how the negotiations are going. I think we really need to leave no stone unturned. So you can also be sharing this information with your friends, your family members, your partners. Be talking about this in the media, on social media. Submit letters to the editor. This one thing that I think I forgot to mention is that this package that is going to be passed, they're aiming before the first week in August, or by the end of that first week. It's probably going to be the last package before the election. That's what Senate Majority Leader McConnell has said. And so this is really our last chance to secure this critical relief for struggling families for quite some time. And as we know, we need it today. We needed it yesterday. We certainly are going to need it a couple weeks from now, and we can't afford to not get it in this package and then go for months without this aid.
Thank you so much. That was great. Stacey, you have some final thoughts?
Sure. I'll just repeat or summarize that I think two of the most critical things we need to be talking about with regards to healthcare right now are this federal package that Deborah just mentioned. It needs to include increased federal Medicaid funding to states, a lot more than has been provided, to make sure, up to this point, to make sure that low-income kids from low-income families, low-income seniors, pregnant women, individuals with disabilities, that the programs they rely on are not being cut. And the other thing we need to focus on now that would be a big help to people losing jobs and going to work every day in low-wage jobs is Medicaid expansion. And that's something we could do right here at the state level.
Jonathan, what's the final thought on workers? How do we support them? What needs to get done?
Yeah, I'll leave you with three final things, specifically around the unemployment insurance and protecting workers. Tying into what Stacey was just talking about, we have to make sure that Congress is prioritizing worker safety and health. So this means making it clear that workers can refuse a job that puts them in an unsafe work environment, puts in stricter guidelines on workplace safety, making sure that masks are mandated when it needs to be in place. These are all things that the federal action would be really important on. The second thing is, like we talked about before, making the unemployment extension and expansions automatic. So putting in place these automatic triggers so that we have this in place when and if it's needed again. And the final thing is, again, this extra $600 a week that we need Congress to act on very quickly, or else we're going to start seeing some very serious impacts from that expiring.
Thank you so much. So in conclusion, general timeline, August, it looks like, is when we're really looking at Congress to take some actions. So they're in recess right now. So please hit up your congressional members and your U.S. senators. Session starts up in January, and that'll be the next opportunity for state leaders to take some action, in addition to whatever executive actions the governor and agencies can take right now. And we really appreciate everybody taking the time to listen to our Facebook Live. You can get more information from our website at everytexan.org. We're also on all the socials, Twitter. We're even on Instagram. We are on Facebook, of course. And please look up our blogs. If you didn't catch anything, I'm sure it's written down in one of those pieces. And if you're still missing some information, still hit us up on an email and we'll get it to you as best we can. And so thank you all for taking the time. Deborah, I know you have a very busy schedule and you are talking to multiple states. So we really appreciate your time and educating us on what's going on the congressional side. So I think we'll leave it at that. And thank you all again. And make sure to share this with your friends and family and get the word out.